Ah, okay,
Yeah.
nice. I saw Westmeath won a big football match over the weekend. Do you know
Yes,
anything
very
about that?
exciting.
Yeah, I'm sure you've seen the flags up everywhere.
Yes.
Perfect. So I think we'll have you take it away, Emma, whenever you're ready.
Great. Thanks so much.
Yeah.
All right. So, as Erica mentioned, my name is Emma Smith, and I'm an associate professor at the School of Allied Health at the University of Limerick. And I am going to talk about developing inclusive and resilient assistive technology policies. And I know that you guys have all been hearing about some really fun and exciting things with respect to the practical side of AT, but we are going to dive into the policy side. And my apologies for anybody who doesn't love policy, but I do think it's really important for us to be able to discuss how and why policy works and when it works, so that we can talk about how to make it better. So, why are we talking about policy at all? I think we all probably can acknowledge that assistive technology enables participation across many domains of life, whether that's education, employment, health, civic life, independent living. And policy really shapes who can access that kind of support, how decisions are made, whether the services remain effective when they're under pressure, and it very much is the structure that determines whether access to assistive technologies is equitable, whether it's timely, and whether it's sustainable. So while policy might feel boring sometimes on the surface, it's not just a document, it's really the structure that determines who is included, who decides, and what happens. So we want to make sure that when we're talking about policy, we're really thinking about the practicalities of what a policy actually means when it gets implemented so that we can really talk about better policy design. So that's where I'm going to focus my energies today. So, why are we talking about policy in particular in Ireland? Um, I want to just highlight that a couple weeks ago, in collaboration between the WHO and the Government of Ireland, we've published the Assistive Technology Capacity Assessment in Ireland. And the QR code that's on your screen should take you straight to that document if you're interested in reading it. The full report itself is quite long, so you'll be forgiven if you decide that you'd prefer to look at the summary report, which is quite a bit shorter. And there's also an easy to read version. But what we really learned when we looked at assistive technology across every sector in Ireland is that we have great systems in many places, but they are generally fragmented, and people don't always know how to get access to what they need, and the policies don't always align with one another. So we have a great opportunity to make that better, but we really need to think carefully about what we think about when we look at that policy. So we really saw persistent barriers, fragmented definitions of what assistive technology is, some gaps in financing. That wasn't the predominant issue. I would say the fragmentation was a bit more of a problem. We know there's workforce shortages and there's not great coordination across sectors. We also know that when it comes to things like crises and emergencies, we haven't really been as attentive as we need to be to making sure our policies are resilient. So this report gives us a fairly strong rationale for why we need a more comprehensive policy framework when it comes to AT. To give you a sense of just what I'm going to talk about today, I'm going to talk about what is inclusive and resilient policy. Why are we even talking about those two words? What's the framework of a framework that I've developed called Arise? What does that structure look like? So then I'm going to talk through the four key principles as well as the 11 policy components within that framework, and then talk a little bit about how you can use it for policy evaluation. So we know the policy problem. Many assistive technology policies are fragmented across sectors. They don't always link up to one another. We also know that policies often fail when eligibility, procurement of devices, the workforce, the funding, and the participation of people who actually use assistive technology are not well aligned. And we also know that there's often a gap between the intent of a policy or what we want a policy to achieve and the realities in implementation. And why does it matter, particularly now? We are experiencing a rising demand for assistive technology. That's due to multiple factors, but in part because we have better awareness of what assistive technology can do for us, but also because we have an aging population. We have increased financial pressures on the system, we have workforce constraints, and we have rapidly changing technologies. And that's challenging our system in terms of how to keep pace with that. We know that assistive technology policy needs to work both when things are going really well, those more stable periods, but also during disruption. And I think we saw a lot of innovation during COVID about how we could actually address some needs around policy, but we need to do better still in terms of making sure that our policies really address those disruptive moments a bit more effectively. Sorry, and thinking about resilience as actually a core policy quality. So it's not just something we add to policy, thinking about resilience, but it's something we need to think about from the start. So what is ARISE? ARISE was designed as a practical framework and an evaluative tool that helps to strengthen assistive technology policy and practice. It was designed to be adaptable across different stakeholders and different contexts, and to provide a snapshot of how mature a policy is rather than a full systems assessment. So that assistive technology capacity assessment that I showed you earlier, that's more of a full systems assessment, whereas ARISE is more meant to look just at a set of policies or a policy ecosystem itself. It can support policy development, but it can also support policy review, advocacy, teaching, or comparing and contrasting policies across different areas or different jurisdictions. Generally, we're trying to promote resilient and inclusive policies. So resilient meaning that when things change in the wider ecosystem, the wider environment, that we're still able to use the policies that we have and that they're still fit for purpose. And enabling environments. So making sure that the environments that we use these policies in and that we use assistive technologies in actually support the use of those products and those systems. ARISE was developed through a participatory process with assistive technology users, policy researchers, and experts in assistive technology all across Europe. And the intention is that it's usable across contexts, but also sectors, so that the theory and the concepts that are within it could be used equally at the organization level or at the national level or the subnational level when we're talking about specific policies. It brings up the question of what we actually understand policy to be. So we use the word policy, but we don't often define it. So we want to acknowledge that policies exist within an ecosystem. So they exist within the context of lots of other things that are happening at the same time. And they might include legislation, and that's often what we think of when we think about policy, but it can also include guidelines for programs. It can include specific schemes for access. It can include guidance that we provide in terms of how to provide assistive technologies, or it could include organizational policies about how we serve the clients that we work with or the users that we work with. So when we're thinking about policy, we're not only thinking about the content of the policy or what's written, but we're also thinking about how that policy is actually used. So how it's implemented, how we provide services, and making sure that those are aligned, because that's not always the case. And we're always often finding challenges where we have a beautifully written policy and what's on paper looks lovely, but the actual reality of what happens on the ground doesn't necessarily reflect what's written on the paper. So the ARISE framework, really, we looked at these two concepts of inclusive and resilient. So comprehensive and integrated systems that give timely access, and timely is an important piece of this, to appropriate assistive technology. So the assistive technology that somebody actually needs and can use and is appropriate to their condition, as well as to the environment that they live in, within a human rights context. So making sure that we consider policy and assistive technology access within the human rights context. But we also want to make sure those policies are flexible and they have the capacity to serve not only the needs today, but also future users' needs across a variety of changing contexts, because we know that our own needs change, but so does the environment around us. So the ARISE policy framework, this is a big slide with a lot of information on it. And I'm just seeing there's an error on that slide where it should talk about workforce. It just says N. I'm not sure how that happened, so apologies. But I'm going to talk about each of these concepts individually. But the general architecture of the framework is that there are four key principles, which are that policies be rights-based, participatory, sustainable, and innovative, and 11 policy components. So I will talk about each of the 11 policy components individually, but each of these is a component where we think a policy should have this at least somewhere within the written policy, and that we should be enacting those policies. Those four principles are cross-cutting across those 11 components. So we should be seeing that something is rights-based in governance and leadership. We should be seeing that it's participatory when it comes to awareness and information. So we don't want any of the those four key concepts or key principles to not appear in any of those key policy components. So I mentioned that there's four key principles, and those are that policies should be rights-based, that they should be participatory, that they should be innovative, and that they should be sustainable. So good policy is not only about what we talk about in terms of the policy, but also how we govern ourselves and how we think and act within the policies that we develop. So they should reflect these ideals. We should be thinking about these ideals when we develop them, and we should be making sure that what we do in terms of implementation also reflects these four key principles. So when we're talking about rights-based as a principle, this is the fundamental concept that access to assistive technology is a human right itself. So people should have access to the technology that they need in order to be independent and in order to do the things that they need or want to do in their lives. But we also acknowledge that access to assistive technology is a pathway to the realization of other rights. So there are specific rights which you may not be able to access if you don't have access to the necessary assistive technology. So not only do people have a right to access that technology, but having that technology is a pathway to realizing additional rights. When we think about rights-based in with respect to policy, we're thinking about the necessity of universality of access. So any person, regardless of who they are, what condition they have, what their needs are, they should be able to access the technology that they need according to their need. We think about the principles of equity and non-discrimination. So it's not simply enough to say, well, everybody has access to this particular piece of technology, but rather that we look at it from an equitable perspective, acknowledging that people may have different needs and therefore may need different technology in order to support those needs. And the principle of non-discrimination, thinking about ensuring that our policies do not intentionally or unintentionally discriminate against particular groups on the basis of age, sex, gender, needs, diagnosis, location. So really looking at non-discrimination broadly and acknowledging that discrimination doesn't always happen on purpose. Sometimes it does, but that often discrimination is actually an unintended consequence of a poorly written policy. Rights-based approaches also require that we consider things like affordability and accessibility. So can you actually get access to that product, and can you get access in a way that is affordable to you? So considering that within the lens of a rights-based approach means that we need to remove those barriers in order to ensure that people have access to what they need. And then the respect for dignity, autonomy, and informed choice. So ensuring that when we provide assistive products to people, that we are doing so in a way that respects the individual's dignity, that they have autonomy in terms of whether they want to use that product or not, or they have autonomy in choosing how they access and how they use that product, and informed choice in terms of what products are available, what the risks and benefits of them are, and making sure that people have access to that potential for informed choice. When we think about participatory, this requires that we have meaningful engagement, and meaningful is an important word here, that it's not just token engagement, but meaningful engagement of assistive technology users at all levels of policy. So whether that's the development of new policy, whether that's the implementation of the policy itself, or the evaluation of those policies, that we have assistive technology users engaged in that process in a meaningful way. So this means that we need to place emphasis on things like co-design, not just of products themselves, but co-design of our policies and systems. That we need to emphasize within our services that we do shared decision making. So it's not one person making a decision on behalf of somebody else. That in general, we want to be prioritizing user-centered approaches where really the person who needs assistive technology is at the center of everything that we do, and that when we think about the products and services that we do provide, that they're adaptable to suit a diversity of needs, recognizing that when you've met one AT user, you've met one AT user, and everybody's needs are different. So we need to make sure that our policies are truly adaptable to that wide variety of needs. When we think about the principle of sustainability, we're talking about making sure that our systems are not only environmentally sustainable, which is often what we think about when we think about sustainability, but that they're also financially, socially sustainable as well. So that we have integrated and coherent assistive technology systems that are integrated with one another so that you don't have to perhaps move from one system to another in order to get different products, or perhaps lose products when you move from one system to another. that they can withstand changing economic systems. We know that as things change, budgets change, we need to make sure our policies don't suffer as a consequence. That we have effective coordination across all sectors that provide assistive technology, and that we think about things like efficiency of our services, that are we have vi very viable financial and service models, and that doesn't necessarily mean that everybody is going to get access to any product in the world that they want, because we don't necessarily always have the funding to do that, and in fact, most cases we don't, but that we find those viable financial systems that allow us to still provide equitable and universal services. And that we do still consider the environmental impact as well, and that we consider the idea of circular economy where products come back in, that they get reused, they get refurbished, they get recycled, and that we minimize the environmental impact so far as it's possible in terms of our provision. And then the last of the four key principles is around innovation. So we broadly consider innovation, whether it's innovation of products themselves, but also innovation of services. So service delivery should be innovative. We should think about new ways to do service delivery. And I will tell you, when we went through the process of the assistive technology capacity assessment across Ireland, we saw incredible examples of innovative service delivery. So we're actually doing that quite well. We need to have innovation in workforce development. We know that there's a huge shortage in terms of the workforce, which means we need to rethink how we provide products. We need to engage others. We need to engage AT users in that process. That we have innovation in terms of how we do capacity building, that we think in innovative ways about our regulatory environments, and then also in how we generate evidence to demonstrate that assistive products are effective and useful. That innovation helps the system to adopt new solutions while also making sure that we maintain safety, quality, and responsiveness to the real needs of individuals. So then if we move on from the principles to the components, we have 11 components that are core features of inclusive and resilient policy. And I would say that these are aspirational. They're things we're aiming for and hoping for, but they are important when we're thinking about comprehensive policy. So not all policies will necessarily have all of them, but they're things that we can push for and advocate for. And all of these principles were based on both a review of the available research evidence, but also a process of expert consensus that included assistive technology users. So our 11 components are conceptualization, governance and leadership, service delivery, financing and affordability, the assistive technology workforce, standards and quality assurance, innovation, research and development, rights protection and advocacy, awareness and information, emergency preparedness and resilience, and monitoring and evaluation. I know that's a long list, so I'm going to go through each one independently. So when we're talking about conceptualization, this is just how we actually define what assistive technology is. So a good policy should clearly and comprehensively define what is meant by assistive technology within that policy. If you look at Ireland as an example, we have, for example, the aids and appliances policy from the HSE. The aids and appliances policy speaks largely to assistive technology, but they don't use the language of assistive technology. So that conceptualization becomes very important. When we think about governance and leadership, policies should be clear in terms of who is responsible for what. So there should be a coordinated structure and approach, and there should be consideration for shared responsibility. And when we're talking about shared responsibility, we're acknowledging that assistive technology is provided across a range of contexts. So it may be provided in education, it may be provided in workplaces, it may be provided in the health system, but there needs to be some coordination between those, and we need to acknowledge that there is a shared responsibility to provide services to people. When we think about service delivery, our policies need to reflect a commitment to an evidence-based service delivery model that addresses the entire assistive technology pathway and the life cycle of a product. So that's everything from the identification of need that an individual has through to a referral process, the assessment that somebody may go through, the provision process itself, which may include a trial or multiple trials, then the actual provision of the product, and the follow-up maintenance and evaluation that follows. So really looking at that full sense of a service delivery pathway. When we're considering financing and affordability, policies should very clearly spell out how assistive technology is going to be financed, how it's going to be paid for by the system, and how it's going to be resourced. And in the places where there may be some shared cost models, where somebody may be responsible for a part of the cost of their assistive technology, or perhaps a basic product is provided by the government and it's covered, but perhaps somebody might be responsible for any additional cost, that needs to be very clearly laid out and it needs to be well considered, considering those four
Mm.
principles we already talked about. When we think about the assistive technology workforce, policy should clearly be addressing provider roles and competencies. So, what does somebody actually need to be able to do, and what do they need to know in order to provide assistive products? And we need to make sure that we're actually planning adequately to meet the need of the entire population. When I talk about workforce, I think it's really important to mention that the assistive technology workforce doesn't only need to include health and social care professionals. It also should be including assistive technology users who potentially are in peer-based roles. It can include community workers. It can include people in local authorities. It can include librarians. So we're really talking broadly about who represents the assistive technology workforce. When we're thinking about standards and quality assurance, we need to make sure that the products that we're providing and the services we're providing, that they're of high quality and that they meet the necessary safety standards to protect individuals who are using assistive products so they're not receiving products that are unsafe or services that are unsafe. But we also have to recognize that there may be risk associated and that is part of the process. If you're a wheelchair user, there may be a risk, if you're a manual wheelchair user, of a tip and fall or of going over backwards. If you have a backwards tip, that might be a risk that is worth taking, but a risk that you should at least be aware of. So ensuring that we are understanding actual risk, making sure our standards are proportionate to that risk, but at the same time avoiding having standards that are unnecessarily restrictive so they reduce the potential access to certain products. When we think about innovation, research, and development, we want environments that are going to foster responsible innovation, make sure that when we're creating and innovating, that we're serving genuine user needs, not just innovating for the sake of innovating, and that we reach all populations who may have an assistive technology need. With respects to rights protection and advocacy, our policies should have clear avenues for addressing the violation of rights of access or the use of assistive technology. They should support assistive technology users and their organizations to advocate for their rights, and there should be measures for preventing discrimination against assistive technology users built into policies. Policies also need to consider awareness and information, so mechanisms for information platforms to provide accessible, current, and comprehensive information about what is available in terms of assistive products and services, but also what the eligibility criteria is for those products and services, the pathway for somebody to access them, and the mechanisms for funding them. We also need to think about emergency preparedness. We know emergencies happen. If we think back earlier this year to a significant flooding in many communities, um, this is one of those areas where people may have not had access to the necessary products that they needed, may have not had access to their homes. So we need to consider emergency preparedness regardless of where we live and regardless of the context that we're in. This needs to make sure that AT systems and users are protected when we have a crisis, and that if we have a humanitarian response need, that we're prepared to adequately address assistive technology in that context. And then finally, monitoring and evaluation. We should have policies that are comprehensively evaluating and monitoring their own systems, addressing what's coming in, what the processes are to produce the output, what outputs and outcomes there are in terms of that policy, and then to assess the impact on broader system. And that would include things like equity, resilience, and sustainability. So who can use this framework? It can be used by policymakers, but it can also be used by advocates to talk about where we may have gaps in some of our existing policies. It can be used by organizations of assistive technology users to consider where they might focus their advocacy efforts. It can be used by researchers who may want to evaluate policy and may want to look at perhaps comparative policy across different jurisdictions. It can be used by service providers to understand what they should be looking for in terms of a good comprehensive policy and also what they might be needing to provide in terms of service provision. We can use it to teach about what good policy is, and students who may be doing some work in the area who are learning about good policy or learning about provision can also use it. And I think we would just focus on saying that we'd hope that this framework would be used in a participatory way so that if we are using it to do an evaluation, for example, of a policy, that we have meaningful engagement of AT users in that evaluation so that it's not just evaluation for evaluation's sake by somebody who may not have a full picture of the realities of the experience of assistive technology use. So just very briefly to tell you, there's also, as part of the framework, there is an evaluative tool where you can actually score a number of different concepts that represent the four principles and the 11 components. So there are questions in the evaluative tool that represent each of the components. There's scoring for each of those across 0 to 5, and there's guidance as to what meets each of those scores. So scores, a 0 would be that a policy component is absent, whereas a 5 would say that it's a comprehensive and well implemented component of the policy. But there's no aggregate score. So we haven't said, if you score a 35, that's a moderately high quality policy. We haven't given an aggregate score. And the reason to do that is because we want to make sure that you're evaluating policies and identifying the gaps, evaluating the maturity of a policy and recognizing that you may have some great things within a policy and there may still be room for growth. So not giving an overall score, but really just allowing it to help us understand where we may need to really focus our efforts. So in summary, ARISE is a practical way to review whether your AT policies, whether that's at the organizational level or the national level or anything in between, whether those policies are rights-based, whether they're participatory, sustainable, and innovative. It covers the essential system components that are needed for equitable access, and it links the principles, content, and evaluative use all into one single framework. So I've given you another QR code here, and I'll just leave it on the screen as we open the floor for questions. But if you want to access either the framework itself, that document, or the infographic that's shown there as well, you can access those through that QR code, and they are available and open source, freely available online. So, if there are questions, I'd be happy to take any questions that there are out there.
Thank you so much, Emma. It's wonderful to see that there is work being done from the policy side of things because oftentimes we just think about kind of the everyday, this tool or this tool, but it's good to see the big picture behind all of it. So huge, huge thank you. Yeah, the floor is open for questions if anyone has any. I know Darren's talking about how bright the future is with policies like these. Little joke there about using meta glasses because the future is so bright.
Yeah, meta glasses are going to challenge us all, I think, in terms of making sure our policies are resilient, but also making sure that we respect the privacy of everybody in the
Yeah,
process.
true.
Yeah.
Yeah. We'll just leave it open a few more minutes for questions. Here we go. Just wondering the major challenges in implementation of the policy rather than the creation. So you've talked us through kind of the creation, but were there any kind of pushbacks or any issues with the implementation?
Yeah, so I think implementation's always tough because we go into development of policy with the best of intentions, and often there are unintended consequences to that development. One is that we often don't have a full picture when we develop a policy about what the realities of making that happen are. So actually getting it into practice, sometimes we find the gaps in the policy when we go to implementation, but that just really highlights the need for that ongoing monitoring and evaluation. And then the further step, if once we do the evaluation, actually going back and changing the policy to meet the need. So I would say it's often just the unknowns when we go in to implement. But it also really highlights, I think, for me, the critical need to have people who are actually going to be living and working with the policy in the room when we do that development itself. So that often helps to address some of those implementation challenges because the people who actually need to implement are the ones who are participating. And then I would say that implementation is constrained by real world experiences, and that's one of the challenges is we we face real budgets, right? There are real financial constraints. We have workforce challenges. So we can have the best policy in the world, but if we don't have the workforce to implement that policy, then it can remain a challenge. So it's those real world constraints where you can have a perfect policy on paper, but then the realities of the
Mm.
world mean that the policy doesn't get implemented in the way that you might hope.
Yeah, we see that all the time, not just in the assistive technology sphere, but in all sorts
Totally.
of policies.
Yeah.
Just kind of wonder personally, has this garnered any interest in other institutions, or is it kind of used cross-institutionally at all, or is it strictly kind of
So
sticking? Yeah.
we published this just in February, so it's still very new.
Mhm.
As part of the development of the framework, we did spend time doing pilots across 6 different countries in Europe, looking both at institutional policies but also national policies. So we have tested this framework across those and this evaluative tool. It has been interesting to see that process. When we did it in Norway, for example. Norway has quite a robust assistive technology system. So it was interesting to do it in that context because they are kind of seen as the gold standard in
Mhm.
terms of what's being provided. And they were even able to use this to identify some gaps in their existing policy. So it was exciting to see that even
Cool.
in a really good system, they're able to use this to identify some of those gaps. I think we've had some discussion around looking at this in different country contexts, but also for organizations who are looking at developing new policies, even just at the organizational level. Although you may find that it's written somewhat with the idea of sort of a government or a subnational government in mind, the principles are still the same and the
Yeah.
components are still the same. So we can still use all the concepts even at just an organizational level.
Yeah. I'm even thinking internally and ahead, like in any organization, it could be useful, really. Yeah.
Exactly.
Perfect.
Yeah.
So another question there, Neil is asking, does implementation take a long time? And is that a challenge? Good question.
It's a great question. It depends on the degree of change, I would say. So if we're looking at sometimes it's about codifying a policy, but we're already doing the work, in which case the implementation might be little tweaks here and there, but and that might not take as much time. Sometimes we're talking about whole systems change, and that does take a long time. That can take years and significant investment in order to do whole systems change. So I think it depends on the scale and the scope. But one of the things that I think is really important is that we acknowledge that we can make changes to some things that will have meaningful impacts, even if we don't have a system-wide change. And so, not to forget that we can make meaningful change even without doing a wholesale, multi-year, massive investment, that small changes are sometimes what makes a huge difference. And hopefully, the framework can help identify where those little changes might be.
Definitely, it's kind of the plus one approach with
Yeah,
UDL, one small change, and it can kind of have a trickle on effect too
it can.
to widening change.
Yeah,
Um,
for
yeah,
sure.
we have Stephen, who we know well. Stephen was on our Students with Disabilities Advisory Group. Is just saying thank you for your talk, and it really relates to his undergraduate research on the challenges faced by young adults with a disability. So, just a
Great. I'm
thank
glad
you
to hear
from
it, Stephen.
Stephen. And then we have Darren talking about the importance of this framework and how it's super relevant right now. Let's see, lots of AT being suppressed by academic integrity concerns and AI policies not considering AT. So maybe you can comment on that a little bit, Emma.
Yeah, this is one of those questions around resiliency when we talk about
Yeah.
policies needing to be able to cope with change and cope with technological development. I think, as you said, through no fault of their own, there are lots of assistive technologies that are implementing AI to facilitate access, which is good. But then we're seeing that the policies are not able to cope with that change. And so that's a question of looking at making good policy and really
Mhm.
evaluating where the policy unintentionally perhaps discriminates against people, or where it has unintended consequences and outcomes. And to me, that's a matter of really good evaluation of
Yeah,
the outcome of a policy. Yeah.
definitely. And it's good that you've thought about that as well, because it's important to look at it from all angles. So very important.